Good afternoon and welcome to this live broadcast brought to you from ZTN Studios right here in Harare. It is State of the Nation and my name is Blessing Munatsi. This program is brought to you by Zim Papers Television Network ZTN in partnership with High Achievers Coach International Academy, HAIC. Today we are discussing a topic that revolves yet again on the impact of COVID-19 on our day-to-day lives. Specifically, it's the impact on the education sector. Successive lockdowns in 2020 had ripple effects on the Zimbabwean school calendar, with the schools going for months without opening. It became apparent that COVID-19 was not just some wave that would pass by. Schools had to reopen and examinations had to be written. Fast forward to now, the school calendar is in motion amid a raft of measures introduced by government. As of the 16th of April, Zimbabwe's Health Ministry had reported 37,534 cumulative cases of COVID-19 and 1,551 deaths. So COVID remains relevant. Today, we seek to ascertain, are pupils safe in Zimbabwean schools in light of the COVID-19 pandemic? To help me unpack today's topic, I have stakeholders in the education sector. I am joined in studio by three gentlemen. Taungana Ndoro, the Director of Communications and Advocacy in the Ministry of Primary and Secondary Education. Dr. Tapera Chikandiwa from the High Achievers Coach International Academy, and Mr. Goodwill Tadera, Acting Secretary General for the Zimbabwe Teachers Association, ZIMTA. Of course, during the course of the show, we will also be joined by Mr. Obet Masaraure, the President of the Amalgamated Rural Teachers Union of Zimbabwe. That's ATUZ, and he'll be joining us via telephone. Gentlemen, welcome to the show.
Thank you.
Thank you.
Now, during the course of today's program, do feel free to share your contributions through our social media platforms. That's on Twitter at ZTN_news, Facebook at Zim Papers TV Network, and also YouTube, that's ZTN. And now, Director Ndoro, we are dealing with a pandemic, and the worst thing we can do right now is speculate. The ministry is coming out of a fresh assessment of the whole COVID situation around the country. What is the current status on the magnitude of cases in our schools, especially after the reported cases over the past weeks?
Well, the current status is that we've got about 5 provinces which have been exposed to COVID-19, where we've got about 22 schools that have reported cases of COVID. And we have got cases of around about, including this is learners and teachers, which gets to about 550 cases of COVID. We have not experienced any fatalities in our schools. Our schools are still safe, and there's no need to panic. Some of these cases were because of a lax in the adherence to the standard operating procedures and the World Health Organization protocols that we've put in place, including certain government directives that were also put in place or announced to ensure that we minimize and manage the spread of COVID-19 in our schools.
Mm-hmm, mm-hmm. Now, you did also highlight the issue of the source. Have you managed to zero in onto the primary source of these outbreaks?
Yes, the Ministry of Primary and Secondary Education has managed to establish that the source of COVID-19 in our schools is the communities. There is no COVID in our schools. All our 9,625 schools don't have COVID. COVID is brought by people in the community or by learners who are taken by parents to go back into the community and then come back to our schools. But our schools are very safe. Mm-hmm. And we have got all the parameters in place, the World Health Organization protocols in place in our schools. The schools do not have COVID. Mm-hmm. The COVID is found within the communities around our schools, further from our schools, and particularly those who move up and down in between our schools. Mm-hmm. Those are the ones that bring COVID into our schools.
We're talking about the safety of pupils today.
Yes.
Can you share with us the safety protocols that are followed whenever an outbreak occurs? What does the ministry do?
Okay, the safety protocols are not just there when there is an outbreak. We start from screening. We screen every learner who gets to any school center using the thermometers, which have got enough and sufficient batteries, and then as they are allowed into the school, or if they have got exhibit signs of a high or abnormal temperature, they are put into a holding bay, and then within the holding bay, then we contact the rapid response team from the Ministry of Health and Childcare for further management, and where we usually are in contact with health facilities that are within a radius of less than 1 kilometer of each and every school. Then, if suppose your temperature is normal, you still then are allowed to get into the school. They also check that you're wearing a mask. You wash your hands. Either you wash with liquid soap or with bar soap. You wash you get your hands sanitized. In some other schools that are more innovative, you even get fumigated, and your vehicle also gets fumigated before you get to the school administration. When you get to the school administration, the same process is also repeated, because between the time you leave the gate and the time you get into the administration, you could have exposed yourself to COVID, or you could have brought in COVID to the school. So the same process is also carried out, checking whether you're wearing your masks, and you're not allowed into any school administration building, in fact any building, if you're not putting on your mask and if you have not sanitized your hands. And we ensure that there are markings for social and physical distancing. We don't have congestions where perhaps parents want to pay school fees or they want to inquire. We ensure that the distance between each client or stakeholder is at least 1.5 meters to 2 meters. And these protocols are repeated over and over again on a daily basis. It is also done with our learners. The learners, they have got different break slots depending on the enrollment of the school. You'll find that Form 1s will probably go on break at some different time, from Form 2, Form 3s, and so on and so forth. They, in their classrooms, they are also spaced to ensure that there is physical and social distancing, and they're also all putting on masks. Even the teacher who handles perhaps the stationery has got, each and every teacher has got a sanitizer at their desk, and they also put on masks. Mm-hmm. So we don't even encourage group works or things like that. You'll find that most of our schools now, we've got furniture where it's only one person per desk, mm-hmm. and then the next 1 meter, 1.5 meter, there's the other learner. Mm-hmm. So they can talk, but they don't get close to each other. Physically, they're not close to each other.
Okay, I think that's clear in terms of those protocols. We will get into the other protocols, what happens in case of detection of COVID cases during the course of the show. Mr. Tadera, if I can come to you, what is your comment on the measures that have been taken thus far regarding their adequacy and also instilling the much needed confidence?
Okay, thank you very much for that question. I think what has been done so far in terms of the standard operating procedures, I think ministry is very good at coming up with blueprints. But I think practically on the ground, we see different interpretations on the ground. And actually, when you really get to schools, what is written in the standard operating procedures, some of the things are not really being followed to the letter and spirit. As we speak, all we hear is that there is money that was set aside for provisions. In terms of social distancing, if you get particularly to rural schools, I'm not so sure about urban schools, but I think also in many urban schools, in terms of social distancing, it's really a challenge. Because the desks that were there then are the same desks that are still there. And even as we speak, the structures that were there then are the same structures that are still there. We've heard of tents that were to be set up. I have not seen any. We've also heard of the sanitizers. Some of the schools got them way back when schools opened last time and closed. Up until now, they have not received any. And for us, it becomes a serious cause for concern.
Maybe, Director Ndoro, I'll give you a chance to respond to that. I've got a few questions that talk specifically to the issues that you were raising there, the issue of the provision in terms of our preparedness for the schools, and also making sure that we implement the planned the planned protocols. Maybe Dr. Chikandiwa, the issue of social distancing that Mr. Tadera is highlighting versus congestion in schools. You are on the ground, in ensuring the rollout of these guidelines and recommendations. How feasible has it been to implement, the recommendations that have been made by ministry, and what can we improve, to ensure the safety of our children?
I think the most important thing that we need here is that people must understand that the COVID pandemic is not just a government responsibility. It is a community responsibility where everybody in the community must understand that we need to fight this together. If we do not fight COVID together as a community, we will not make it as a nation. So I believe that, like they highlighted, there are desks that are there. I think these are double desks. The ministry procedures are very clear on that you can actually block the learners, that some of the learners come to school maybe in the morning and then others come in the afternoon, so that desk which was used by 2 people can actually be available for 1 learner now. And you can actually block them maybe according to times on a day where we have the hot seating arrangement. But there's another arrangement which can be taken, which is maybe whereby the learners can come to school maybe 3 days a week. Maybe a group comes 3 days, Monday, Wednesday, and Friday, and then another group can come actually on Tuesday, Thursday, and Saturday. You can actually put in the Saturday there because we are in an emergency. So I believe that what the ministry is saying is a beautiful blueprint which requires the teachers, the parents, the SDCs must actually be on the ground to ensure that all that is being suggested becomes a reality, because on their own the schools cannot make it. But together with ministry, with the parents, whereby people have to pour in extra resources, the private partners are now allowed to assist in our situation where they have to capacitate the schools. And I think there is nothing impossible there. Impossibilities are basically in our minds. But on the ground, we all have capacity to make sure that things work.
Now, Director Nduru, the risks that Mr. Tadera was alluding to, the risks of the pupil in the less developed areas. Have we, looked and assessed the risk and exposure of, the pupil in the less developed areas? And also, do we have mechanisms to bridge the gap between our plans and actual implementation? The surveillance mechanisms that we've put in place, are they fully implemented? And what are the different measures that are in place to be deterrent for the schools that are found wanting?
Thanks a lot, Blessing. You'll find that when we go to the schools and we have our monitoring visits and we are finding out whether they are adhering to World Health Organization protocols, one school here and another school a kilometer away, they're operating very differently, as he is saying. Now, this is no longer a question of the standard operating procedures being just a beautiful blueprint. It is now a question of leadership. And here we're talking of the school head, the responsible authorities, the TIC, the deputy head. And some of them are members of Mr. Tadera's organization. These are the ones who are supposed to take this burden on themselves. That, at my school, you don't come without a face mask. At my school, you don't enter without washing your hands. At my school, you're not going to just visit learners, randomly and for no apparent reason. Things that you can actually use technology. You can call my school. The next school, it's a different situation. The head is just there, is letting, perhaps the head is not even putting on a mask. What will the learners learn? So this is a question of leadership, and we appeal to Mr. Tadera and his organization and other organizations to instill a sense of leadership, because this is a public health, national public health emergency, that there should not be any complacency within our school leadership. Yeah.
Let's talk about early detection. Early detection, early disclosure. This is quite critical. I know one of the schools in Matabeleland had more than 250, well, it was between 2 schools.
Yes.
It then becomes critical for schools to disclose early. what can you tell us about, you know, the procedure when it comes to notification with the ministry and kicking in of those corrective steps that we take?
Thanks a lot. You will notice that our schools, thanks to the leadership that we have in government, they have become a barometer to detect early any cases of COVID. You may have communities that are overrun by COVID, that may be actually COVID hotspots, but they do not have the mechanisms or the standard operating procedures to detect that there is COVID here. But when you then come to our schools, we then kick in our standard operating procedures and quickly isolate or quarantine an infected learner or teacher. That then assists the entire community through contact tracing, that this person came from this area and they had contact with so and so. Then we actually then detect COVID within the communities. So our schools have become a very important surveillance system for the detection of COVID cases within the community and within the nation.
Mr. Dera, do you want to comment maybe on Dr. Chikandiwa's point that, you know, this should be an all-inclusive effort? I think Director Ndoro was also alluding to that. It is everyone's role really to fight COVID in the schools and to increase that confidence. Do you want to comment maybe on that?
Quite right, and indeed I think it's everyone's task, like the doctor has said. And I think the major challenge comes particularly when you look at some geographical locations of some schools. When you look at the rural schools in particular, you remember we are coming from a period where learners were not coming to school and schools were not receiving any resources in terms of financial support. And now what the communities are saying now is that now you are saying our children should come to school 2-3 days, and so should be the fees that we must pay. And that becomes a challenge to the school in terms of procuring the necessary basic resources. While we talk about the protocols, which are very good, I agree with Mr. Ndoro. But in terms of provisions at the center, where things must begin to happen, there is serious shortage in those areas. And when you look also at visits to the schools, particularly in rural areas, parents do not even care whether their learners have masks or not. And sometimes even the parents themselves don't even bring one. Fine, they are barred from the gate, they go back to collect. But you find a child putting on a mask, a surgical mask, we understand it must be worn for about 4 or 5 hours, within hours. But you find learners bringing those, and they have them for the whole week. And I think government must come in heavily, and stakeholders, of course, I agree with the doc, to make sure that in those less developed places, there is serious support in terms of masks, in terms of sanitizers, in terms of wash facilities. I think it is that area that I think stakeholders must come in heavily in order that we curb this pandemic. I agree we are in this together. But you also realize that the teachers, schools have opened. They are coming from different directions to the school. And we are not surprised to hear that schools are getting affected. Why? Even the learners, they were coming from different areas. And up to now, we have teachers who have not yet been tested. And seriously, I heard Mr. Ndoro was saying within a kilometer or so in terms of referral facilities. But tell you, when you get to rural areas, you can go as far as 5-6 kilometers to a nearest clinic. So I think they must come up perhaps with mobile facilities where they must visit the schools and make sure that perhaps all the teachers are tested, including perhaps learners, particularly in the secondary sector, that they are tested right. But we have hundreds of people, isn't it, at a school level. And I think government must invest in that to make sure that there are mobile units that will come to the school and test. Unlike a situation where we have to wait to detect and then we refer. I think that would be a second too late. Thank you.
Now, Dr. Chikandiwa, you know, dealing with pupils daily, what is your assessment, you know, of the psychological impact, especially on the learning population? There's a cocktail of issues that we're dealing with here, issues of stigma, issues of varying backgrounds, and of course the different ages of the learners.
Is what we call pedagogy. Most, if not all of our teachers in our secondary schools and primary schools have done pedagogy. They've done sociology of education, psychology of education, and philosophy of education. These teachers are huge resources. They are able to counsel the learners. For example, at my school, I've prepared the learners. They're quite excited to be back in school, quite excited to fight COVID. We've taught them that if it comes, we are supposed to solidly work together, because this is an enemy that we know. You know, if it was like an enemy that we don't know, then it was going to continue hitting us. But we now know how the enemy behaves. And COVID, we know how it behaves. And the learners are excited. They are following protocols. They are actually going even home to educate their parents. So I believe that the learners are in high spirits. And for your information, the learners don't want to be at home. They want to be in schools. And we'll talk about maybe another issue where I've actually investigated. I carried my own research maybe in terms of the Anglican Diocese of Manikala, and check how prepared are they as a diocese, as a stakeholder and in the country fighting COVID with a number of cases at their schools. And you'll be shocked that really the government and the mission schools have prepared adequately for our fight against COVID.
The fight against COVID is a common fight, and this broadcast is brought to you by ZTN in partnership with the High Achievers Coach International Academy, that's HACIA. Our show today, we are looking at the COVID-19 situation in our Zimbabwean schools. Are our pupils safe? Don't go away, we'll be right back. Welcome back. This broadcast is brought to you by ZTN in partnership with the High Achievers Coach International Academy, HACIA. On the show today, we're looking at the COVID-19 situation in Zimbabwean schools. Are our pupils safe? Now, Dr. Ndoro, we do have a comment that's coming through, a rather question. Sorry. You should say I receive. Now, Director Ndoro, we do have a question from Paidatsuru, who came through our, Facebook, handle, and we know, the VP has given us assurance that there is nothing to worry about really regarding the COVID situation in our schools. Can you give us an insight into the challenges, in containing the outbreaks and also the actionables that arise from your recent evaluation? Is the ministry on top of the situation? That's according to Paida's question. And what is the situation in terms of our boarding schools? What happens when, there are cases there, and how do you actually go about the quarantine process and making sure that the affected children are separated from the other children without the stigma, and also while education carries on?
Yeah, thanks a lot for that blessing. You will find that it all depends with the numbers. The schools that I mentioned, quite a number of them have got very minimum numbers. There are just about 5 schools that have got numbers that are a bit on the high side, you know, like Sacred Heart, Mbakwe and stuff. Those are the hundreds or so. But the ones that have got low numbers, the standard operating procedure quickly isolates them. They are then managed through the Ministry of Health and Childcare, and if need be, even if it's a boarding school, they can even be taken home whilst the parents have been advised of the protocols that they should take whilst putting that learner in isolation, because it's just probably one learner. And then learning does not stop, it continues at the school because perhaps it's just 1 or 2. But where we have a case of hundreds of students who have tested positive for COVID.
We need to use the same dining facilities.
It's a bit different now. It's a bit different. We quarantine the school. No parent is allowed there. No visitors allowed there. Those who test positive are put in an isolation bay or quarantine, and they are treated and fed from there. Whilst those who test negative are also put in their own bay, and we wait for an incubation period. If it prolongs and we keep getting those who are negative, then testing positive after a few days, we don't release those who are even negative because probably it has just not kicked in. But if it is showing that those who tested positive are the only ones and these ones are negative, they may then be even released to continue schooling from home. But we work very closely with the Ministry of Health and Childcare to ensure that we don't infect or have those ones who are negative have the virus spread to them. So when the numbers are a bit on the high side, we totally shut down the school. Learning only continues for those who are negative, and including teachers who are negative. But if it continues, you continue to have numbers of those who were negative then becoming positive, then we completely shut down the school.
Here, obviously, we've got contact tracing and everything happening, but do we have, mass testing? Because this is what maybe an ordinary parent would assume happens.
Precisely. There's always mass testing when there are huge numbers. I can assure you that at Mzilikazi, it must be Mzilikazi Primary yesterday, there was mass testing going on and contact tracing going on to ensure that those who are negative should remain negative, and they trace to find out from their school, because this is now a Ministry of Health prerogative where they're going to the homes to find out whether there isn't anybody who does have COVID, and then we will take it up from there.
Dr. Chikando, you want to add on to what Director Ndlovu was saying?
Just this morning I was talking to the Bishop of the Anglican Diocese of Manikele and just checking with him what's the situation, and he gave me one of the most exciting points I have to give you today. For example, Bonda Hospital has got a capacity of over 160 beds, right? And it therefore means that if this case here is to become quite serious, the school has got capacity, because it's a mission school with a mission hospital, has got capacity to handle everything. So we've got several mission schools around the country with mission hospitals adjacent to the schools, and therefore because of this, the parents really do not have to be worrying seriously about it. They just have to give this issue to professionals, to the Minister of Primary and Secondary Education, to the Minister of Health, to handle it. Because if we start communicating on social media, in most cases we are misleading each other. Social media is good, is bad. I think there is a lot of panicking that's taking place because people are communicating wrongly. And I also know that the government, when it was preparing, I think we're quite a prepared nation, because the government, through the president, I think there's been a lot of activity whereby the rural hospitals, the rural clinics, the satellite clinics were all prepared to handle such a situation. So I believe that our situation in the country is quite safe for the learners. We just need to give the professionals time to handle this. And if you are a layman, in this, please don't comment negatively, because you may actually be creating a chaos. That's unnecessary.
All right, thank you so much, Paida Tsuru, for that question. I certainly hope that you have been answered. Mr. Derera, now let's look at some of the initiatives. Hot sitting, alternative timetables, some of the initiatives that have been introduced to make sure that there is social distancing and reduced numbers at any given time in our schools? Traditionally, now we know the issue of the teacher-pupil ratio has been also a concern. Can you comment now the effect of the measures on the actual load of the teachers and how they go about their teaching business?
Okay, thank you very much for that question. You've taken words from my mouth. I wanted to say is the issue of hot sitting, the blended learning approaches that the ministry has come up with. It's very good. But I think the issue of teacher-pupil ratios remains a serious cause for concern. Right now, as I speak, I am a teacher myself. So I'm talking practically from what happens on the ground, on the shop floor level. Unlike people who then come up with papers while they are in their 7th floors. As I speak, schools are not well staffed in terms of teacher-pupil ratios. We have classes where we have more than 50 learners in a single class. We have teachers who have transferred in some areas, and the teachers have more than 70 learners in a class. And you talk about blended learning, the alternative days and so forth. Isn't it overburdening a teacher who then will have to make sure that they cater for over 70 learners in a single class? And when you look again, going back to the geographical locations, learners cross rivers. They travel 5-6 kilometers to school. And alternating the timetables only works perhaps in an urban setup. We have tried it in the rural areas. And at the end of the day, it becomes a challenge, particularly for the administrators. You then have to make sure that learning is going on without due regard of specific issues surrounding the protocols, like what he said. Otherwise, no actual learning will take place. You get to rural areas, even when you want to look at the online learning, it's non-existent, even if you wanted to. Those teachers who are at school while others, their learners are not coming, they cannot follow up on the learners who have gone home. So it's really a challenge. But we appreciate the aspect of alternating days. We appreciate the aspect of hot sitting. But you will notice that some of these things have already been in existence. And the schools are overwhelmed.
But I was about to say, we are in a sort of like a war situation.
Quite right.
Is there any other way? Because we are really trying to salvage the situation. Because it's a give and take, really.
Yes, I agree. But I think what is most critical is the issue that you alluded to, the issue of staffing, of making sure that we increase the number of teachers within institutions. I think ministry tends to drag its feet when you come to issues around staffing issues, because the teacher-pupil ratios really high as they are, and we are talking of combating the pandemic, it really becomes a challenge.
Okay, Director, I'll give you a chance to respond. The raft of measures obviously recommended call for resources, human resources, financial resources. Do we have adequate resources, to monitor and implement the policy recommendations? And also, let's talk about that government provisional commitment of 600 million for the schools reopening. What was that primarily meant to address, and has it been parceled out, towards the COVID-19 effort?
Yes, I will go back to the issue, Blessing, of leadership. Leadership in schools is very important, and I will reiterate it, Mr. Tadera. Where you find that there is a class and a headmaster is allowing the class to have 70 learners, this is not really the problem of the teacher. It's the leadership. The leadership knows the standard operating procedures. You should not have more than 35 learners in a classroom under whatever circumstances. You have got alternatives to alternative learning. You've got hot sitting. You need to be innovative as a leader. When you are at a school head, you are the CEO of that environment. So if you let that environment crumble to have 60, 70 learners in one classroom when we're experiencing a national public health emergency, I think you as a leader, you must question, you must be brought to question as a leader.
Is it avoidable, Director Ndoro? Because if we look maybe at the rural setup, maybe there's one school within the 10, 15 kilometer radius. Maybe the numbers are already ballooned. Can it really be avoided?
Particularly in rural schools, the issue of COVID, as you can see, it's very minimal because they control, and this is where they have these alternating days. It's actually very good for them. These alternating days, you don't alternate without giving those children homework or work to do. When they go and they're not coming back to school for 2 other days, they've got a lot of work to report with when they come back. So it's not like they're going to be lying idle because the work, because of the blended learning strategy, is now, it means that the work is a lot more. So even if they think that they go and I've got 2 days away from school, there is a lot that they need to cover when they go back to school. So these are strategies that we have put in place. So this is why we're saying the issue of leadership within our schools remains very, very critical. We, as a ministry, do not condone a school where there are 60, 70 learners in a classroom, and there's a headmaster, there's a deputy head, there's a TIC, there's a senior teacher, allowing that to happen. And yet we all know that we're in a pandemic, we're in a crisis, and you allow that to happen. So of all our 9,625 schools, it's very difficult to go and see that this one or that one, unless we get the report, and then we then go and inspect and see that, look, what are you doing? You are the leader here. Make the alternatives. Do the hot sitting. Do the alternative learning. Be innovative. Sit with your staff. Say, guys, look, we need to do things differently now because we're in a new reality. But some of them, they're so complacent, and they are still leaders of our schools.
Okay, granted. Can we have that comment on the, the provision for, the COVID effort? How far are we in as far as, parceling that out?
The government has done as much as it can in providing funds and resources for the provision of PPEs. But it's, as Dr. Chikandiwa said earlier, this should not be just a government issue. We have got SDCs. They can also make sure that there's a levy just to make sure that they purchase within communities where probably the school is crumbling. We need PPEs. Mr. Mnatsi is now the calling. It's a calling for the entire community. It's a calling for active role. I went to Kutama College, and we've got a very vibrant alumni where we go to Kutama. Even when Kutama had 1 case of COVID, we were there as the old boys to ensure that we put things in place. So it's not just a government responsibility. Let us put all hands on deck and not neglect our education system.
Dr. Chikandiwa, I'll give you, maybe you want to add on, but I just want to highlight 2 issues. Mr. Dera, in his submissions, he silently, suggested that maybe the process of coming up with recommendations was not maybe as inclusive as he would want it to be. Are you happy with the levels of consultation that the ministry is doing, 1, and also 2, the issue of testing of children before they get into schools? Is it feasible? Is it fair? And is it affordable?
Maybe I'll start with the issue of testing students, just maybe on a shotgun approach. You just say, let's just test everybody. If there are no signs that there is an infection that's taking place, I believe that it is a waste of money to test learners, because that money could be invested in prevention. Because what if you test everybody and then you find that basically the learners are negative? So I believe that it's important for us to invest in prevention. Prevention is better than cure. So if we can have the schools, as I said before, the schools, the SDCs, the community, the partners, I think the ministry works with a lot of partners. If we can have all those, putting resources to ensure that the schools, they've got sanitizers. How much are they? How much is a bar of soap? how much is a bucket of water? We can be able to prevent COVID in our schools by making sure that we invest into that and ensuring that we have to test when it's absolutely necessary for us to do it, but not just be testing for the sake of testing. I don't think that's a good procedure.
Mr. Adira, let's look at the issue of access to information and awareness. Also looking at the marginalized areas, the remotest parts of the country. Do you feel that there is enough effort, to educate the pupil, the teacher, in the marginalized areas?
Okay. I think I wouldn't want to sound as if I'm against what all the other programs that government puts in. But I think together with stakeholders, like what other colleagues are saying, we must invest very seriously into this access to information. Because when you get to the marginalized areas, there is not even network. And I think teachers, there must be a lot of in-servicing of teachers. Right now, as we speak, not all teachers have gone through this training of how to handle COVID-19.
As an association, have you also, initiated some of the trainings, maybe for your members or some teachers?
As an association, what we have done is, of course, under the guidelines of COVID-19, not very much has been done yet. But we have programs where we get into contact with our members and educate them. We actually have produced even an online magazine to make sure that we reach out to all our members. But again, the major issue is the issue of connectivity throughout the nation. How much I wish the service providers like the Econet, the Net1s, the Telecells could increase, perhaps in partnership with government, increase connectivity so that it gets throughout the nation.
Throughout the whole country.
Yes.
No, granted. Director Ndoro, we are heading towards a close. Some of the initiatives that we talked about have obviously an influence on the curriculum rollout itself. The quality of education, what is going to be the impact here? Are we still going to meet our curriculum objectives at the end of the day?
Yes, we are very confident that COVID has sort of become a kind of like a blessing in disguise. As Mr. Adira is talking about connectivity, as government, we have rural and remote areas to ensure that is becoming self-sufficient, becoming the ones who build solar farms in Uzumba, Maramba, Fungwe, or in Njombe, wherever, themselves because of this education that they are now receiving. So we are confident that by the time we get to 2030, we will be an upper middle economy by that time.
Okay. Right. As we head towards a close, maybe I'll ask each of you to give us your closing submissions, maybe in just 30 seconds, and then we round it off. Starting with you, Dr. Chikando.
Yes, I would say Zimbabwe, this pandemic may be here to stay with us for many years to come. We must come out of hiding, and together let's bring our artillery and let's bulldoze into COVID-19. And we are going to defeat it. I am very much confident that we'll make it together as a nation. And we want to thank the President and the Cabinet for fighting through to ensure that our learners are safe and our communities are safe.
Mr. Adira.
Yes, thank you very much. One other extra aspect, I think, will also assist us, particularly in school setups. I think the issue of teacher motivation remains key and critical in delivering. Because you see, a demotivated teacher will not put their all and might. And therefore, ministry, we expect our ministry of primary and secondary education to also assist us in pushing our employer to make sure that they cover that gap. Because once they've covered that gap, I think they will be able to get maximum effort from the teachers. And now that we are also getting into winter, we understand that it is during this winter time that the pandemic can spread even faster. And I think ministry must come in heavily as well to make sure that they target all the disadvantaged schools and assist them. Because it is the financing that is a challenge in those areas. In some schools, elite schools, or even some average schools, urban schools, it's not really much of a challenge. But in disadvantaged areas, it's really a challenge. And we don't want these schools to become epicenters of the spread of this pandemic. I thank you.
Right, Director Ndoro.
Well, thanks, Mr. Mnatsi. You will notice that, let me reiterate that our schools remain very safe havens for learning, for the continued learning. Our parents and guardians should not panic. We have put in place the standard operating procedures and the protocols as directed by His Excellency from the World Health Organization. Those protocols directed that His Excellency said we should have them in place at every school before we opened. And we have put those in place. So parents should not panic. And learners should also not panic. We, last year, did not have a single fatality of our learners. We envisage that this year again, even though we've had cases of COVID, we will not have any cases of fatalities in our schools. And therefore, our schools will remain safe as we work together with our development partners and with government. Thank you.
Thank you so much, Director Ndoro. Optimistic words there. There you have it. It's very important that we remain proactive more than we are reactive. Of course, the schools do not operate in vacuums, and the COVID-19 pandemic, as you heard, it's a fight that you and me should be involved, all stakeholders, hands on deck, fighting this pandemic. And now we've come to the end of our show today. We were looking at the safety of our pupils in Zimbabwean schools in light of the COVID-19 pandemic. I'd like to thank my panelists for today. I had in a studio Dr. Chikandiwa from the High Achievers Coach International Academy, HACIA, Mr. Goodwill Taderera, Acting Secretary General of the Zimbabwe Teachers Association, and Mr. Taungana Ndoro, the Director of Communications and Advocacy in the Ministry of Primary and Secondary Education. Gentlemen, thank you so much for your input. Many thanks also to our viewers who followed this discussion online. This program was, of course, brought to you by Zim Papers Television Network in partnership with High Achievers Coach International Academy, HAKE. You can visit our website, ztn.co.zw, to get in touch with more of our programming. My name is Blessing Mnatsi. Thanks for watching and have a good day.